Solidarity forever. Solidarity forever.
What we are saying here today as the unions in the health sector is that we reject the resolution to extend the contracts for UHC staff for the next 3 years.
The Kenya Union of Clinical Officers have rejected the Council of Governors' resolution to extend the contracts of close to 9,000 medics employed under the Universal Health Coverage Program for another 3 years.
The healthcare workers are the good example of any hustler in this country. So if the president cannot listen to these hustlers, then I do not know what kind of hustlers he can listen to.
The medical practitioners led by KUKO National Chairperson Peterson Wachira have threatened to soon down their tools in solidarity with their colleagues should both national and county government fail to implement the previous agreement.
Early next week, on a day that we are going to communicate, all the leaders of the health unions in the health sector, we are going to walk and invoke Article 37 of the Constitution to present petitions to public offices. We will be calling our members and Kenyans of goodwill to walk with us to Harambee House, where we are going to present the first petition, and then to the Ministry of Health, where we are going to present a petition and Parliament, and we shall be demanding to have a sitting with the CS Health so that we can be able to resolve these things.
They held a joint health unions press briefing to address the state of issues in the health sector UHC staff, salaries and remuneration commissions SRC overreach, and collective bargaining agreement CBA conclusion, which saw COG led by Chairperson Governor Anne Waiguru resolved to extend the clinicians' contractual services for 3 more years.
And as KMPD, we are really disappointed that the government, both national and county, could spend 3 days of taxpayers' money in a beautiful hotel in Vasha to discuss everything healthcare and come up with nothing meaningful about our plight.
The Kenya Union of Clinical Officers General Secretary Dr. George Gibore Maroa threatened to lead his members for demonstrations should the meetings with Parliament and Health Cabinet Secretaries next week bear no fruit.
This act is not only prejudicial and discriminatory, but also abhorrent in nature, and goes against the doctrine of fair labor practice ordained in Article 41 of the Constitution of Kenya, as well as the Employment Act number 11 of 2007, Law of Kenya on fair labor practice and discrimination.
The medical practitioners castigated the government move, referring to it as prejudicial and discriminatory towards its members, calling on the COG to hire and enlist them on permanent and pensionable terms. Gibore termed the move as illegal and irregular.
Will further be extended by 3 years on similar terms as in the previous contract. This has come at a time when we expected these healthcare workers to be absorbed into permanent and pensionable terms, and the resolution from the summit can only mean that all these close to 9,000 workers will continue to suffer discrimination and prejudice.
Stanley Lugaria, the informer, uncovering the truth.
Forever. Solidarity